Alrighty, guys and gals, I guess. Welcome back to Packology Outdoors. We're going to do a breakdown of a little bit more in depth of my trauma kit, med kit here. I mentioned it when I went through my day pack, but now we'll do a little more focused breakdown of this pack itself. So, for background, I guess, I'm an ER nurse. I have background in pre-hospital care. I used to work on the ambulance. I did search and rescue. So medical is kind of in my realm of expertise, I guess. So I have a fair amount in here. A lot of it is more trauma oriented. Obviously the first item right here is a tourniquet. This is a CAT, official CAT tourniquet. And I think this is probably the go-to. There are other options out there that are approved by the Committee for Tactical Combat Casualty Care, TCCC. But I think this is probably what most people are going to be familiar with and is kind of the standard in the industry for the most part. This is used to control massive hemorrhage, and it does take practice. So don't just throw one of these in there and think, all right, I'm good to go, gonna save all the lives. You do have to know what you're doing when you put these on. Next up, an ACE wrap. Super basic, super easy, good for all kinds of things. Wrapping rolled ankles, improvising splints, securing splints. You can use it as a pressure bandage if you have some kind of wound that is not tourniquet level yet, but still needs some good amount of pressure applied and maintained. So those two things live in my pack, but not necessarily in this bag, just because they're a little more bulky. Starting from the outside of the bag, I have 2 sets of gloves, kind of just tucked in here for quick access. Can pull this out, grab the gloves, put them on without having to rummage through. And then I have a set of shears here, pretty heavy duty. These are relatively inexpensive off of Amazon. They're not the cheapest, they're not the most expensive. I have a set of the Leatherman Raptor shears that are my primary shears that I use at work. But those are pricey, in the $90 range, and so I don't have multiple of those to just stick around places. But these work good. I've used them. They stay sharp, they hold an edge, they cut through all kinds of stuff. Getting into the interior here, I try and keep this as organized as possible. You can see some things in here are loose, like this other pressure bandage. This is an Israeli style pressure bandage from MyMedic. You can use that in conjunction with the ACE wrap and some packing gauze here to make another one of these if you needed to. But this one just comes ready to go, which is nice. Then I have a little pocket CPR mask, just a super basic face shield in case I have to do rescue breathing. In the backcountry, there's kind of limited application for that unless I'm going in with a whole team of people and we're gonna evacuate a patient to safety. The response times for professional personnel into the backcountry, if you're doing bystander CPR, the chances of a successful outcome may not be all that high. But do your best, do what you can, and just have that understanding going into it. Up here, you can see I've got more gloves throughout because anytime you change patients, or if I need to get into my kit and I don't want to bloody the whole thing up, then I change gloves. So I have several sets of gloves here. Then some roller gauze, just for basic wound care. I do also have tucked in here a Bic lighter, because you can never have too many Bic lighters. Some medical tape, more roller gauze. Over here is more of the trauma-oriented stuff. So this is a nasopharyngeal airway with some lube. This is designed to go into the nair of your patient and help protect their airway. It bypasses the back of the tongue that might be occluding their airway and helps facilitate adequate respiration and breathing, or adequate ventilation, excuse me, in a patient that may be having difficulty protecting their own airway. This piece of equipment here is highly specialized, and you have to be trained on how to use it. This is a needle decompression needle, and it's used to relieve a tension pneumothorax, which is a life-threatening emergency if it develops from a punctured chest cavity. In the back here, this is kind of just my boo-boo kit. So in here I've got Band-Aids, I've got Tylenol, ibuprofen, some bacitracin ointment, alcohol wipes, a little bit of Benadryl, and some Dermabond, which is basically just medical super glue. This is a set of vented chest seals. So these are from North American Rescue, Hyphen Compact Chest Seals. These are used to close off open chest wounds. So if you have a penetration into the thoracic cavity that lets air in, can collapse the lung. It destroys the negative pressure system that makes your lungs work, and can lead to a tension pneumothorax if air continues to build up in that cavity. So you slap this over there, they're very sticky. Slap this over the wound, press it down, and it will prevent the air from getting into the chest cavity. The vent part of it means that the air hopefully will be able to escape back out and avoid creating the tension pneumothorax. You can also burp these and just kind of lift up one edge if you notice your patient is starting to have increased difficulty breathing. And if you keep on top of that, be observant with your patient assessments, you will be able to avoid the pneumothorax or tension pneumothorax. In the back here, I just have some gauze, gauze squares, non-adherent dressings, and a Mylar blanket, because hypothermia kills, and especially in trauma patients or critically sick patients. Their body does not thermoregulate well, and when you get cold and hypothermic, then your blood stops clotting adequately, and if they are bleeding out somewhere, that's going to increase the blood loss because their blood is not clotting, and then your patient dies. So we want to avoid that. Then I think that's pretty much it. Oh, this pocket over here, I just have kind of more assorted. I've got some Coban, more kind of athletic style tape versus the Medipore tape, Gorilla tape, duct tape, because it's so useful. Back in here also I have a triangle bandage with some safety pins. This is great for making slings. You can improvise splinting material again, secure splints in place, or if you had to, you could improvise a tourniquet, but again, you should have at least one of these, and you shouldn't have to improvise a tourniquet. And then in the back, just some moleskin for taking care of blisters, hot spots, things of that nature. One last thing I forgot to address is this packing gauze. This is also from North American Rescue. It's just a square of compressed gauze. This is not a hemostatic agent like Combat Gauze or Quick Clot. Those are very expensive, and I'm cheap. And so this is $3. The combat gauze is $45. You do the math. I can get a lot more of this. And so this, if used properly, packed into a wound, accomplishes the exact same effect that the combat gauze, quick clot gauze does. It may take a minute or two longer comparatively, but if you've got it in the right place, if you're actually applying direct pressure to the bleeding vessel, then you're going to be okay. You'll be able to pack that wound and stop the bleeding. I think that wraps it up for this. All of the medical gear is great to have, but if you don't have the training to actually implement it and put it into practice safely and effectively under stress, then it's not going to do you a whole lot of good. So I highly recommend you go out, take a Stop the Bleed class, take a basic first aid class or a CPR class. They're offered in the community through American Red Cross, through American Heart Association. If you talk to your local fire departments or police departments, a lot of them will offer classes for the community periodically throughout the year. So I would encourage you to look into that and get the training. Thanks. Please like, subscribe, share, tell a friend, all of that things, and we will see you next time.